Yes, so did I. We are so far from living in a democracy, so far from. And this is a very, very important case in many ways. It sounds terribly pompous to say that, but actually orthodox medicine is on trial here. My colleagues and I practice orthodox medicine based implicitly on the history of the patient, the physical examination of the patient, the correct clinical evaluation of the patient, making a diagnosis, treating that, the disease, and monitoring the patient. That is what we do, and that is the kind of medicine that should be practiced, and that is really being challenged now by when that comes into conflict with the beliefs, the diktat of public health. It is no longer in some way permissible to do that. So medicine is on trial, and if we lose and the position of the Department of Health is endorsed, their ability to persecute doctors in this way is upheld, then what happens in the future? What happens when there's a drug-related injury to a patient? What happens when a new complication emerges from a treatment or a vaccine? Doctors are going to say, hey, it's too bad, I'm sorry, I'm not going to get involved. Because you've got a big pharmaceutical industry there with their friends in government that are going to come down on me and make my life misery. And it happened with thalidomide, and it's happened time and time and time again. Every time a doctor has put his head up above the parapet and said this vaccine or this drug is not safe, then his world has been turned upside down. Well, it's not a reason to walk away from it. In fact, it's every reason to fight it. Because otherwise we just hand over, just give up. Just hand over the world to the drug companies and walk away.